Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then layers of conjunctiva. Conjunctival layers. So layers of conjunctiva are of three types. First we have an epithelium is present. This is the epithelium with an adenoid layer and fibrous layer. What is this epithelium? Epithelium is actually a stratified squamous non-keratinized epithelium. Actually the epithelium should look like this. Stratified squamous non-keratinized epithelium. Okay, then we have adenoid layer, which is actually a connective tissue with lymphatics. So this is the adenoid layer, which is a connective tissue with lymphatics are seen in the adenoid layer. Then we have fibrous layer. In the fibrous layer, it contains blood vessels and nerves are also seen in the fibrous layer. Then there are three types of cells. Goblet cells are present. Actually, these goblet cells are the cells which secrete mucin, and these are present throughout the conjunctiva, and they are more dense on the nasal side. They are dense and they will secrete the mucin or mucus layer of the tear film. Then we have melanocytes. Melanocytes are also present in the eye. They are mainly present at the limbus, fornix, curuncle, and in the anterior ciliary vessel site. In all these three sites, we see melanocytes. Melanocytes are present in limbus, fornix, curuncle, and at anterior ciliary vessels. There are also Langerhans cells. Langerhans cells are present all over the conjunctiva. So these are the layers of the conjunctiva.
thank you and thank you for watching.